Okay, hopefully I'm being recorded now. This is the EPACT 2 Right Care UTI Focus Pack dashboard overview. Lots of you have been very, very kind to join us. My name's Paul. I work at the NHS BSA, the people who provide these dashboards, the EPACT 2. I'm the training and engagement manager. I recognise quite a few names who have signed up and have joined the call. I think a lot of you have had sessions with my beautiful team, with Dan or Rob. You're getting me this time. Apologies. Basically, my job is to show as many people as possible how to get the most out of our data. I can see that I've got more person to admit. I show people how to use EPACT 2, but I also show people how to use dental systems, ophthalmic systems, all that kind of stuff. So I'm a bit of a jack of all trades, master of none, which is why the fantastic Elizabeth Beach, who's a force to be reckoned with and an absolute expert on this stuff, and she's been a driver behind the development of this. I should have said Elizabeth Beach MBE. She's joined us on here. I will let her say hello in a second herself. And we're also joined by Lydia Gummersall from NHS Right Care, who's a brilliant senior analytics manager and is a driving force behind the UTI Focus Packs, which we'll mention. This dashboard is a kind of accompanying piece to the Focus Packs that NHS Right Care produce. I'll be covering the content, the purpose of the dashboard, how to get in there and how to use it. I am going to really quickly show you where the Right Care data packs live. For those of you who haven't tracked them down or want to have access to them, I will mention that. But I'll basically take us on a tour of the dashboard. There are 9 metrics in the dashboard. The idea is really CCGs, PCNs, GP practices want to hopefully use this dashboard and the metrics to improve the management of urinary tract infections in primary care, with a particular focus on older people. That'll all become clear as we start talking about it and we start going through the context and actually showing you the dashboard. But that's the point of all this stuff. So really, really quickly, I don't want to bore you too much. We haven't got loads of time with like the context, but I think it is important. This dashboard's created. You're all on this call because we know that we have a bit of a battle on our hands, a challenge to overcome around antimicrobial resistance. Government reviews in 2016, new 5-year action plans coming into place. The idea is we want to reduce antibiotic prescribing in humans by 15%, as it says on the slide, by 2024. And maybe the bigger focus for us is the 25% of reduction in antibiotic use in the community. So we know we've got that challenge to overcome. We also know we have an element of a challenge around just incorrect diagnoses, if I can say that properly, diagnoses of UTIs. That leads to unnecessary antibiotic use. We know that can increase the risk of antibiotic-resistant infections in the future. The idea is the context pretty clear around why we want to overcome this problem. A little bit more specifically, and this will become clearer when we start looking around the dashboard. The dashboard very, very much focuses on trimethoprim and nitrofurantoin. Again, this is where you can start laughing at me for saying things incorrectly. So I can see there's someone else waiting to join the meeting. Well, thank you very much, whoever let those guys in. There were around about 31 million antibiotic items prescribed in primary care in 2019, 2020. A huge proportion of the antibiotics that go to older people and nitrofurantoin and trimethoprim, especially with treatment of UTIs. And basically, it's about, hopefully this dashboard's going to highlight the variation and the types of prescribing that you'll see for the treatment of UTIs. And I have got a purpose slide here very quickly. Tracking that variation across your organisation, across the country, at region, STP, CCG level, within PCNs, within individual practices. That's what this dashboard's going to help you to do. There's a definite focus, or an added focus, on inappropriate antibiotic prescribing and antibiotic resistance in the over 70s. There's a metric, which is one of my favourite metrics. You'll hear me go on about it a lot. That lets you see the actual number of patients that are prescribed trimethoprim more than once within a 3-month time period. So you can really focus down on the actual individual patients. And in general, you'll be able to track other areas that might warrant investigation, something you want to check, improve on. And the other little advantage is being able to track progress against things that you're trying to do to improve this. What I mean by that is the dashboard in EPACT 2 is updated on a monthly basis. I know some of you will roll your eyes slightly because it is always slightly behind the latest month. So we're in November's month in the data, and we'll soon have December's, but you can track progress on a 12-month rolling basis to see if your actions around this prescribing are having an impact, and we'll show you that in the dashboard itself. And I did really want to quickly mention that this is an accompanying piece to the actual Right Care Focus packs. In those packs, that covers a lot more. We mentioned the primary care prescribing, which is the same data as this dashboard, but the packs themselves, and I'll probably allow Lydia to speak at some point, and she can mention this a little bit more, how things about risk factors, inpatient admissions, lots of other things, and they're available on the NHS Futures platform. And I did say that I would show you that in a second. And one last thing, this is to save the question that I always get every time I ever do a session where this is mentioned. Star PU. This is one of the things we use in this dashboard to weight the graphs and the metrics we show you to specific therapeutic groups, antibacterials, and weighted for age and sex. The idea is we're using this star PU weighting to make sure that we can better compare. Again, I'm sure there'll be one or two on the call who are rolling their eyes slightly or tucking slightly. I know not everyone loves star PU as a measure, but it's a standard one. It might be slightly out of date, but you will see that's used a lot in here. And that up on the screen for a second while I'm blabbering away is the actual definition of the star PU. But after me blabbering away like that for far too long, I am going to jump into the dashboard itself. What I'm going to do is, as I'm showing you this, I will take you through a few of the different pages. I'm going to mention a few of the different metrics. I'm also going to try and shut up at different times, look at some of the questions if there are any, and also let Elizabeth and Lydia speak at different times. So if you go along with me, I'll try and let you know when that's happening. Oops, wrong one. There we go. Hopefully you can see the fantastic and beautiful NHS BSA website. Never ever try to find anything on it because it'll be impossible. But know that this page exists, EPACT 2. All I'm going to very quickly mention is for those who are maybe less aware, I don't want to assume people know everything about EPACT 2. I'm not going to bore everyone to death. It holds so much data, but it's all of the prescribing data across primary care. It's a platform that you show it. Lots of you use this system. This is where you would come if you haven't already registered. There's a link there, and this is where you would access it. I'm the training manager, and I can't help but have this many captive audiences to mention a little bit about training. We have a user guides area. On there, there's specific guides for PCN users. I know some of you guys are on the call. For practice users, I know some of you guys are on the call. Not enough people use these. We've got videos, guides, specifically designed. And don't think I'm neglecting my CCG users. You guys get loads of stuff because you can build all sorts of analysis. You get pages and pages and videos and videos. Makes me feel better if those YouTube videos get more views. My bosses will be happy, so go and click on some of them. There's also a way to book webinars with us. So after this, you might think, Paul, that was brilliant, but can I actually speak to some of the experts in your team? You'll go, of course, you can book a training webinar and we'll cover any EPACT 2 topic, just so you know that that's there. Just checking because I can see. Yes, I apologize. I can see a couple of things in there. There is Elizabeth mentioned that we've got Dr. Kieran Hunt here. That's fantastic. I should have introduced Kieran, and also there's the link to those to those packs, but I will show you on the page as well. Right then, let me jump in. So when you log in EPACT 2, you'll be taken to this fantastic landing page. It's a little bit old-fashioned and a little bit blue, but it has to be because it's the NHS. And all I really want to tell you is all the good stuff, especially for most users, is hidden behind this little dashboard link. And if I give that a click, it'll take a while to wake up because I've been sat here talking for a while. But when it does, it will take me to all of the clinical dashboards. I get good at filling. There we go. Lots and lots of other fancy dashboards in here. I know a lot of you guys on the call will have used them before, but if you don't, they're there. Have a click through. There is guidance on the website. But today we are going to have a look at the UTI, Right Care UTI Focus Pack dashboard. I've already got it open, and there it is in all its glory. On not the page I was going to talk about, so I'm just going to give that a click. There we go. It will open up onto the national page, which is useful because it gives us a little bit of an introduction, but it also lets you just see some trends for the whole of England. Is worth looking at, and I'll mention some of these in a second. I did say though that I was going to show you where these the actual Right Care UTI Focus Packs were kept. They're on the NHS Futures platform, one or two of you may well have used that. One or two of you have probably accessed the packs already. For those who haven't, I will just open this so it doesn't open another link. Once you've signed up, and you will have to sign up for NHS Futures, the link will take you to the elective care community practice area, and all you need to do is to drop this little specialities drop down and go to urology. I will probably let Lydia speak in a second. I'm not entirely sure whether everyone can get straight into that or whether they still need to just ask for a little bit of permission. There might be like a little box shot, a little email you have to fill in. But I will let Lydia jump in, and probably when we answer a few questions at the end, I'm sure she can clarify that. Okay, then. Back to the dashboard itself. So I did say that there were 9 metrics. On pretty much every page, you will see the 9 metrics that are displayed. It doesn't matter whether we're looking at any organization level, you will see these 9 metrics shown, and I'm going to take you through those in detail in a second. But what you can do is to split, or to think about how you want to view this data, and that's what all of these tabs along the top are. These home and away teams all the way along here. You can decide that you want to see things at a regional level and compare that to national. That will be region versus national. A very common view, and one that we'll start with in a second, would be comparing a selected CCG to all the other CCGs nationally and the national average. But that's what all of these different links do. I promise you, I won't bore you to death by clicking on them all, but I will try and look at a CCG one, a PCN one, and a practice one as we go, just so we've kind of covered them off and had a different look at different things. But yeah, you will see the same metrics on each page. There's nothing hidden on the different pages. Again, apologize. I'm just going to try and move that on another screen so I can see the chat as we go. I will come back to some of these questions. I can see them building up. Oh, it's also because I'm looking at the wrong thing. There we go. And apologies, just while I move around the screen. Okay, then. The important page, because this will hopefully stop lots and lots of the questions that you will rightly have, is this metrics descriptions page, just before I jump in. When we do these sessions, people always rightly ask lots and lots of questions about which chemical substance, which drugs, how things are worked out. This page details every of the metrics and also the drug lists, the numerators, denominators, all the technical information that you may want to know is listed on this page. And these are the ones that you can save me saying the names of the drugs incorrectly. I'll just say, look at the metric description page. Okay, then I'm going to jump in at the CCG national page, CCG versus national page. What I'm going to do is I'm going to take a couple of these metrics at a time, have a little bit of a chat, a little bit of a deep dive, and then I'm going to bring in the experts to talk about them as well. So I will give them warning, but I'm going to go 2 or 3 at a time, and then we can have a little bit of a chat about what they're showing, what they mean, how they could be interpreted. The first thing I get to do, though, because at the minute I'm showing Central London, because that's what my little test account defaults do. I'm trying to think who I want to bully the most by choosing their CCG as the example. I think I'd like to pretend I'm on holiday in Cornwall. And if that's the case, just to show you, you can all do this when you use the dashboard. I can drop this down and search for the beautiful Cornwall CCG. You can see I just type it in there, double click on it, and then press apply. You can do this for your own organizations. For those of you who are used to EPACT 2, you'll know that it'll probably default to the organization you work for. However, if it doesn't, for whatever reason, you might end up at Baines. That's how you would select the CCG you want to focus on and have a look at. And like I say, I'm going to bully the beautiful Cornwall CCG, I think, on this example. It's currently selected to the 12-month rolling period up to November 2020. That is the current latest data in EPACT 2. And if you wanted to pick a previous time period, they're all listed there. It is worth pointing out that for some of the metrics that include list sizes, we can only go back to about, I think it's the start of 2018, but I might have that wrong. I will double check that. But we'll show that as we go as well. We can show some examples. Okay, then. First metric, top left corner here. I'm going to start with this one up here. So this metric is called lower urinary tract infections, combined antibiotic items prescribed per 1,000 oral antibacterials, BNF 5.1 subset, items-based RPU 2013. We like a snappy title at the BSA, as you can tell. However, It is important because that does describe exactly what it's shown. It reports the volume of antibiotic prescribing for suspected lower UTIs, and it's not broken down by population. We're not focused on a certain age band. It's the subset of antibacterials that are used to treat lower suspected UTI, weighted by star PU. In this example, the graph has shown us all these tiny little thin little blades. They're every CCG in the country. The one that's slightly darker, it's very thin because there's lots of CCGs. That is Cornwall CCG, and we've also got a dotted line which is indicating the national average. So we get it above the graph as well. The national average is around about 203 items per 1,000 star PU, and in Cornwall we're 220. So we're just above the average in general combined antibiotic items being dispensed. This is more just for indication. It's not trying, and we're not making any bold claims on what's good or bad about that prescribing. It's just giving us a bit of context to see where this CCG, the selected organisation, sits in comparison to others. What may be the first interesting thing, I'm jumping ahead slightly, and this is where I might bring other people in a second, is the second metric on this page. It's the same idea, but it's the cost-based star PU. So we've had items and we've got cost. It's possibly interesting to note that Cornwall is lower than the average. I'm just looking at that. Yeah, it's below the England average for cost. It has been mentioned, and this is where Elizabeth's fantastic because she tells me these things, that the lower cost in this example, even though they do more than average items, might be because they do more trimethoprim. It might not be, but that could be an indication. We'll see that in the metrics coming up. Trimethoprim's a little bit cheaper than nitrofurantoin. So that could be something to look at. That might be what that's indicating. But it just gives us a context for where Cornwall is sitting. I'm going to stop for a second and I'm going to ask Elizabeth, is there anything you wanted to ask at that point? Or sorry, add at that point before I jump onto some other metrics?
No, I mean, just to remind people that we don't normally use the antibacterial star PU denominator outside of all antibacterials, which is where you'll be very familiar with its use in the two AMR metrics we use routinely to monitor improvement in primary care prescribing. But it's been used in this particular dashboard because Right Care do have a similar and not identical, and there's a question in the chat that we can come to maybe later about that denominator approach. So this is the best we can do to align to that. But really these top two metrics just are giving you a general picture about your total antibiotic use from the list of antibiotics which are used to treat lower UTI. I just think it's interesting to note that we've still got twofold variation.
Cool. Thank you, Elizabeth. I will keep jumping back in and bring you in as and when I can. And I know there's a couple of questions from Philip Baker on there on that, and I think we'll come to those in a second. You're probably going to be slightly disappointed, but we will come back to them. And I think, yeah, as Elizabeth has already commented, but we might be able to cover that as we go as well. The third metric on this one, I think this is where we start getting a little bit more into the nitty gritty, if I can put it that way, is that we're looking at that subset of combined antibiotic items, but this time just focused on patients aged over 70 and the list size of those just over 70. So in this example, we can see for those older patients, the selected CCG of Cornwall is below the national average. It's at the left, towards the left side of this graph, so it is lower and it is below that average. I think what I would be trying to kind of to explain here is we know that, and this has been explained to me many times, that people over 70 shouldn't have UTIs diagnosed by urine dipsticks. This might lead to inappropriate treatment. So basically, we're trying to track, are they doing a lot of items for older people, and it might indicate inappropriate antibiotic prescribing. There's always the might. It's always the in local knowledge. You guys in there working in the practice of CCGs, PCNs, you'll know if there's certain things happening, but that's what this might be showing us. It doesn't look necessarily that this would be the case in Cornwall. We mentioned before that I was mentioning the cost being slightly lower than average, but the items being slightly higher. This may well be explained by the next two metrics. So the fourth metric is the number of nitrofurantoin items prescribed to patients aged 70, a bit like the one before, but just focused on the one chemical substance of nitrofurantoin. And it's very low. not very low, it's an exaggeration, it's below the average, and it's at the lower end of the graph. Again, I'm relying on other people's clinical knowledge, but from what I understand, nitrofurantoin is usually the first choice antibiotic, or should be, or could be the first choice for lower UTIs in older adults. We may be wanting to see a higher value to indicate appropriate prescribing. And I suppose we have to look at it in the context of the next metric, number 5, which is the same idea, but for trimethoprim, which we can see in Cornwall is slightly above the England average. And it might explain a little bit of that cost above, and it might be highlighting certain patterns or habits in prescribing that might be leaning a little bit more heavily towards trimethoprim. And again, the 6th metric, these all kind of come together as a nice little package, really, does show the focus of the percentage of trimethoprim given to people aged over 70. So yeah, the number of trimethoprim items prescribed to patients over 70 as a proportion of all trimethoprim items. And Cornwall's around 50% of all trimethoprams going to those patients over 70. The England average being around 43%. Again, just indicating that possibly there's an action or something that could be done around trimethoprim prescribing in Cornwall. And I feel bad now for bullying Cornwall. I'm not for those, if there is anyone on the call from that, I didn't check that actually as I did it. I'm sure there might be a few. I do apologize, but it's just showing an example for the latest month's data. Again, Elizabeth, I'm going to just stop since I've covered another 3. Is there anything to add at that point?
Sorry, I'm rapidly answering the chat.
Sorry, why you're doing all the hard work?
No, that's fine. I think yes. I think the thing to look at is to. Sorry, I've just got Cornwall joining.
I was going to say, Marco's heard what I'm doing.
The thing to look at is just to clarify that what's new about this is we've been able to report prescription items by age band by the registered GP list size for that age band for the first time. So instead of looking at trimethoprim as a GP practice level and you don't know who it's going to, we've now got trimethoprim prescribed and dispensed to people aged 70 plus as a proportion of all people aged 70 plus on that GP list size. I mean, in an ideal world, we'd be able to tell you the number of people who got all of those prescription items, but we can't do that at the moment. But it does start to give you a better idea of the variation associated with trimethoprim use. In this case, for example, top right-hand corner, trimethoprim use given to people aged 70 as a proportion of that list size, and again the twofold variation we see at CCG level, and equally the nitrofurantoin on that lower left-hand plot, which shows you that for Cornwall, while they've got lower than average trimethoprim, they've got much lower than average nitrofurantoin. And then when you go right over to the right-hand side at the end, you can see that of their trimethoprim use, and this is trimethoprim use to all patients, about half of it is spent, in inverted commas, on people aged 70 plus. So I would say there's an opportunity to see how appropriate that trimethoprim is, given that that's where we've got our highest E. coli resistance associated with trimethoprim.
See, this is why we need Elizabeth here, because she can say that stuff rather than the silly things I say. But that's fantastic. Thank you very, very much. There were 3 more metrics on this page that I just want to quickly mention.
Oh, sorry, Paul.
Yes.
To add in,
Yep.
you right back at the beginning, you mentioned the cost metric,
Yes.
and I think you alluded to this is possibly why.
On this example, more items but lower cost in Cornwall. Yeah.
Yes, and trimethoprim is cheaper than nitrofurantoin. So where you see a lower cost attached with the possibly higher items, it begins to ring alarm bells that you might, well, alarm bell's not the right word, but begins to ring a bell that you might find that you've got a higher use of trimethoprim than other CCGs who might have the same volume of use in terms of items, but have a higher cost.
Yes. And I think if you follow the kind of story through with the metrics, you can see that starts to be borne out in the last 3 that we saw. We can kind of see that trimethoprim is high, the items prescribed is higher than the nitrofurantoin. So yes, thank you very much. Metric number 7. This is the one that I really struggle to say. And I said, are you going to catch me out and laugh at me when I can't say things properly? Cephalosporin. I would expect a round of applause if I got that right. Oral cephalosporin items prescribed per 1,000 oral antibacterials. again, the knowledge around this is I think this is supposed to be the second line choice, more used for pregnant women and children. And so we'll be looking or expecting or hoping to see lower rates to reflect appropriate prescribing. And again, we can see on this example, Cornwall's in and around that national average. Again, you always get that view of the average to the organisation level that we're looking at. So we get the CCG versus England, and we get the same view in terms of a bit like we had before with the all antibacterials. We get the same with the items compared to the cost. I feel really guilty because I know Elizabeth's just finished speaking, but just because them two sit together, is there anything you'd like to add on those ones, Elizabeth?
Yeah,
Sorry,
I do actually. So I think it's even a bit more complicated now, because when this Right Care dashboard was in development 2 years ago, pre-COVID, it's been sort of held up by COVID for a year of publication. At that point, cefalexin hadn't been placed in the NICE guidance for the treatment of acute pyelonephritis, and so the cephalosporin use we were seeing, particularly in older people, generally was associated with the treatment of lower UTI, or even prophylaxis for recurrent UTI, and it wasn't at all appropriate. But of course, now we've got cefalexin placed in the NICE guidance for the treatment of acute pyelonephritis. Because these cephalosporin indicators are not based on age, they apply to the whole population, then we would expect to see it's a bit more muddled up, and we'll need to reflect upon whether this continues to stay in the dashboard, I think, in terms of its usefulness. But at the moment, it does still show again, huge variation in use of cephalosporin, and I'm sure those CCGs on the right-hand side with very high use of cephalosporin, they've either got an awful lot of pyelonephritis, or far more likely, they're probably using cephalosporins in older people to treat lower UTI.
Yes,
but again, it comes back to your local intelligence and local knowledge about what you know is going on in your patch.
It is, and I stupidly clicked a button there that drilled down, so I'm just going to search again very, very quickly. Apply. Yeah, the variation on these, I think, is the thing that stands out. And you're right. I was trying not to click on them, but I did by mistake. Yeah, you've got certain CCGs very, very high at this end and some very, very low. And again, as Elizabeth says, I think when you have your own local knowledge applied to that, there's a lot more insight you can drive from it. And it might be that there's something you want to look at. It might be that is appropriate. But yes. The 9th metric. I know you shouldn't have a favourite, but I do have a favourite. It is the 9th one. The number of unique people of all ages prescribed trimethoprim more than once in any 3 consecutive months within the 12-month period. I like this one because we're less worried about the waiting, which is really, really useful and really, really important. But this gives us a different view. This is showing us the actual number of unique patients prescribed trimethoprim more than once in any 3 consecutive months. And the importance around that is, I think, that's likely to indicate or likely to lead to a treatment failure, particularly in older people. So it's something that people want to monitor. And this should, especially when we drill down at different levels, which I know I'm talking too much, but I will try and get to before we finish the session, should see us a reasonable number of patients that we might actually be able to do something about, the actual raw number of patients. There is no average line on this graph, and there shouldn't be, because we're not trying to use this to track variation, even though the graph looks like you've got that big variation. Because it's not weighted, we've obviously just got different size of CCGs, organisations, practice. That's always going to kind of play a role here. But it is showing us that in this example, in the 12-month period up to November 2020, there are 2,200 patients roughly in Cornwall who have had trimethoprim in 3 consecutive months. Well, sorry, more than once in any 3 consecutive months. And there's around about 150,000 of those patients across England.
And Paul,
yes.
Can we just mention this is again another first-time metric, and it's quite complicated for the BSA to calculate. What they have looked at is each person can only be counted once. So someone who's on prophylactic antibiotics, you can imagine, would be getting it, say, monthly on their repeat prescription for 6 months. You might imagine they would turn up a lot of times in this indicator. So because of that, they've only been attributed to a single patient count. So actually, this is 2,204 patients in Kerno CCG who will have had at least one event, if you call the event trimethoprim more than once in any 3 consecutive months in that last 12-month period. So if we were to count each time a person had that event, it would be greater than 2,204. I don't know if I'm making myself clear, but it is quite a weird metric. And there was quite a lot of thought and discussion about how best to make this as accurate as possible in that respect. And, it gives you some idea of this might be an area where you might want to check that it's appropriate.
Yes, and I think that's obviously really important. And I know that we'll say this whether it's Lydia from MyCare, Elizabeth, or myself. It's not about a judgment. It's not about me sitting here going, if I was in Cornwall, I know there are exactly 2,204 patients that directly need my urgent attention right this second. It's a way of just highlighting that it's possible further investigation, and there will be uses. I can see Lorraine's mentioned, but I think Elizabeth covered off what Lorraine said, but if she hasn't,
So Lorraine, we can't differentiate between what the prescription's been used for in terms of acute treatment or prophylaxis of recurrent UTI. So it would include any prescription for trimethoprim. So if you had somebody having their trimethoprim prophylaxis dispensed every week, then obviously they'd get 4 prescriptions in a month, and so on. So obviously, if you know in your local system, it applies to the whole dashboard really, that you are doing weekly prescribing for some patients on prophylactic antibiotics, that's going to bump your item count up in the whole dashboard data set.
And it's worth pointing that across all dashboards and all of the data the BSA collects, we don't collect the reason for prescribing. So there's always got to have that as a caveat, I think, to the data that you see inside these dashboards and views. Okay, there are a couple of things I definitely want to show everyone. One thing that I haven't mentioned yet is I started when I clicked on the CCG versus national page. I got all 9 metrics in a lovely big pile. A couple of things that I didn't say, which might be useful, it's the technical things about using the system, is you probably noticed above every little graph, there was a select view. There is a possibility of turning this to a data table. The only reason I mention that is I know some people prefer that, and it'll depend on the view you're looking at, that you actually get the big lovely pile of a data table. You can expand that right out using this little double arrow there, and that would give us a huge table of every CCG in this example. And if you wanted to export that, there's an export button, pop that into an Excel spreadsheet, whatever you want to do. It's always possible to get out. You don't need to. The dashboard's there to show you, but I know people often ask, can they get the data out of the system? That's one way you can do that. And the other little thing I wanted to mention was that there is always a second view on each of these pages. This one showed all 9 metrics at once. I can give that CCGV national a click. And what this does is it allows me to pick 1 metric at a time. There's all those 9 metrics sitting there waiting for me. I'll leave it on this one. It was the one I liked. So it's the number of unique people prescribed trimethoprim once in any 3 consecutive months. You get the indicator specification we mentioned before, that was back on that front page, but you do get to see it again here. So if there's anything you need to double check, you can see it there. This one's very simple. You get probably a bigger, more usable or exportable version of the graph. But probably most importantly, this page includes a trend. I did mention at the start that the idea is you can use this dashboard on a monthly basis to see if you are making interventions, making changes, trying to do something locally in your organization. Is it having the impact you want or expect? And obviously you might be aiming to get a trend up or down, depending on whatever the metric is or whatever you're looking at. You can see a monthly trend graph here, which I think could be very, very useful if that's what you're doing. It's just to know that that's just kept on a page next to the main summary. The other thing that I wanted to show, and I'm going to try to leave a couple minutes to even answer the last couple of questions as well. I know Elizabeth's doing a fantastic job of answering things on the chat. Is just to show a couple more of the different views. I was looking at the CCG versus national. A nice view might be, depending on your view, the similar 10 is the CCG versus similar 10, which is obviously what a lot of the right care UTI focus packs are going to be focused on and looked at. It's the same metrics. I'm not going to go line by line on each one, but obviously this time, rather than comparing or benchmarking yourself against the every other CCG nationally, you're going to get an average of the similar 10 CCGs. Remember that I want to look at kernel CCG. I can see this time I'm tracking just below the averages for my similar 10 on a lot of these. And it might just give a different perspective, a different view of the data, help you kind of work out what might be a bigger priority or less of a priority based on how you compare to areas which have a similar demographic, similar breakdown. So there's that view I wanted to mention. possibly more important, because I feel like I've neglected our poor PCN and practice people who are on the call. A nice view might be the PCN within a reporting CCG. So if you work for a PCN, you might think, well, how does mine compare to the other PCNs in my CCG? Give that a click. I think I was playing on this page before, pretending I was in Lincolnshire. Yes, it's remembered that. I was doing that. But again, you can pick any CCG and any PCN within that CCG and then press apply. But yeah, as an example, it's just to show you that you can view things at a PCN level. And this time I've got every other PCN in Lincolnshire shown here. This is where I think the actual number of patients one could be interesting, because it's where you, at a PCN level, possibly the clinical pharmacist could have a look at a PCN level or a practice level to work out if there's some things they could do. I don't want to put any words in anyone's mouth, but just to point out that that's something that might be possible. And if you were thinking of that in a certain PCN, thinking, right, I want to drill right down, I work for EPACT PCN, for example, I could then go to the practice view within that PCN. And I can see my individual practices and look for any differences, variation, outliers that there might be. I suppose in this example, I'm seeing the cost is very high in Newark, lot lower in Booth and Park Medical. I don't know this area. It's just to point out that you can quickly see a variation in cost on items, and again on the different metrics there. There's an example there of one of them which has closed now, a medical practice which is particularly high on the percentage of items that are going to trimethoprim items that are going to those over 70 of all trimethoprim items. And if I was trying to get the numbers down low enough that I might be able to do something to structure medication review or a chat with someone, is a chance to see the lower number figures here of the individual patients that are receiving trimethoprim more than once in 83 consecutive months. There's one thing I wanted to mention really quickly. It's not included on this page yet, and it should be and possibly will be soon. It would be if you wanted to get the NHS numbers for any of the patients that are indicated in that 9th metric, you can request them from the BSA. You may well do your own local searches. You may even, depending on your job, know who some of these people are just by literally looking at the prescriptions, looking at your own clinical system. If you did want them, you can request it from the BSA. I'm just going to jump to another screen very, very quickly. This is on the polypharmacy dashboard. Some of you will use that one, so you might have even used this process before, but you can submit a request to this email address. You've got to have direct clinical care with the patients you're asking for the NHS numbers for. So it's something to bear in mind. If you don't, there's no point putting that request in, and we'll be checked on that. But you can put the name, the practice codes, the things you want to see. And although it says polypharmacy metric requested here, all you would do is probably go in there, grab that out, because that's the one of this on the UTI one, and send that in, and the BSA can help provide those NHS numbers. You've got to wait up. I know we're slightly behind on the data. You might think you can get the data out of your clinical systems quicker, but it's just to point out that it's there.
Paul, there was a question from Spry just saying, can the PCN charts name each PCN in the chart so we can share this with CCG PCNs? So at the moment, it's only naming the selected PCN, isn't it?
Yes. So above here, there's a couple of things. I think it's, you could switch it, but you're right that one or two of the other views, and I'll recommend this. I'll take this as a bit of feedback. Have a graph view with labels. And a data view, and so it individually labels these underneath. They obviously try to keep it cleaner, and you could see if we had that on the CCG views, it would be quite overwhelming. But I think you're right; it works quite nicely on the PCN view. There's normally going to be 2, 3, 4, 5, 6 practices. I'll take away that bit of feedback, but yeah.
Okay, and there's a question from Lorraine. I think that Lydia would be in a really good position to answer about the potential opportunity.
Yes, I didn't understand the potential opportunity items on the right care document. Is there a contact for this? Lydia, I don't know if you're able. Sorry, I'll shut up and let you jump in there.
Yes, of course. The potential opportunities worked out by looking at your rate compared to your similar 10 demographically similar CCGs. And we set the benchmark according to whether higher for that indicator or lower is better. I think for some we use just the similar 10 average. If you want more information on how we calculate that, please get in touch. I think I put the email in the chat, but it's rightcare@nhs.net.
There we go. Thank you very much, Lydia.
No problem.
Another thing I wanted to say very quickly is I did say there was metric descriptions. I think a lot of it is something that you guys can go away use straight away. But we do have, and I should have said this at the start, back on the web page itself, back on the BSA web page, there is a dashboards and specifications area. And just in case you want to kind of look in a bit more detail, find any more information, there is a RightCare UTI Focus Back dashboard page, which does have a specification. So if there's anything in particular you want to look, there's a document on there which could be very, very useful. Do we have any other burning questions? I know I've talked quite quickly and it was a little bit of a whistle-stop tour, but there's any questions people were desperate to ask? You can pop them in the chat. You could even turn your mic on now if you wanted to at that point.
Paul, just going back to Helen Spry's immediate question about labelling the PCNs, I guess until that gets resolved, the only solution is probably to download it as data and then plot it yourself. Possibly,
which I would hate to think you had to do all of the time, but you're exactly right. If once mine wakes up there, I could turn up the data view and you could export that little table of data and either use that if you were going out to talk to people, or you're right, you could pop that into Excel and make your own graph. But my job is to desperately try and get people to be able to do things inside of the system. And so I think it's a really good point that we want to get that view with the labels on included. But yes, I could turn it on that way, export, pop it into a nice spreadsheet, and then you can sit there and do wizardry things with charts and labels and all that kind of stuff. I've got a question there. Please remind us how to drill down to your own practice data. So yes, so on these pages here, whatever page you're looking at, if I'm looking at CCG and I want to look at a little bit more detail, I can always go and look at the practice two views here. So I have these two links. So I can either look at my practice within a selected CCG or my practice within the PCN. And it's these two links. I'll click on the CCG one since we haven't looked at it yet. Give it a second to wake up. But yes, you would just, at this point, it should, and that's always a big should with EPACT 2, default to your CCG and your practice. If it doesn't, you can select them from this list, press apply, and the 9 metrics will update to show the data for your practice or the selected practice. I can't say I've downloaded the sheet, but only have the Devon data. So I will very, very quickly just pop Devon on and show you the example. So I'm on the practice versus CCG. I'm going to select Devon. I'm going to press apply. Give it a second to think. It's got itself a little bit confused and still thinks I'm in the Woodland Medical Group, which is not in this CCG. I will report that as a little bug, but let's say I work for Abby. I didn't know which one you did work for, but I'm just going to pick that one and press apply. And then I will get the individual surgery view of this data. You will see all of the other practices on this view within Devon, so it is worth pointing that out. But whichever one I've got set, Abby is in that list there and is highlighted. And if I turn it to the data view, you're right, I will still see a full list of all the other ones, but Abby surgery will be in there with a comparison to all the other ones. I'm hoping that answers the question, Danny. If it doesn't, please feel free to shout.
Paul, isn't there a speedy way to drill down as well when you're in one of these views, where if you hover over practice name, there's a little row of 3 little buttons, that little. Sorry, can you hover over that again when you're in data?
Sorry, on the data view. Sorry.
Yeah, go into data view, and can you see over practice name in the blue box?
Yeah.
There's that little bar there. Usually, if you click on that, it tends to drill you down to the next level.
Yeah.
I suppose it's not going to be able to do it when we're in practice, but if we were in PCN or if we were in CCG and we clicked on that, will it straight away take you through to the next organizational layer?
It is a good tip. It is a good tip, and it can do that. It does depend on how it's been set up, but Elizabeth's exactly right. It's worth giving it a click, but it does depend a little bit on the developer and whether they've included the drill down option. But that is true. You can sometimes drill straight through from clicking on the thing on the graph or clicking on this data view and having a look. But if not, you can definitely kind of be looking at a certain view and go and pick. I know it's a little bit longer, but at least you know you've definitely got it by picking the CCG in practice that you were wanting to look at, or the PCN practice that you were hoping to look at. But yeah, definitely the focus is, Danny, is to get onto the right page. I know that sounds like a ridiculous thing to say, but obviously if you're looking at the CCG view, you do need to probably come out and think about having a look at the practice or the PCN views. Okay. I've kept you good people for longer than the session was scheduled for. If anyone does have any questions, I'm very, very quickly just going to pop this on the screen and leave it up for a second. It's not the one I meant. Apologies. In terms of contacting the BSA, we do have the help there. I'm sure some of you contact us there. I'm sure some of you have contacted us at the EPACT training team before. And for those who haven't registered yet, I don't know how many there are of you that are in that position. I think we've got a lot of EPACT users. They're the contact details up there. So if anyone was desperate to get in touch, you can find them on that screen there. But also you can contact us through the website as well. If you Google EPACT, you would get to that main page and you could see all the links to these email addresses on there too. Other than that, I will say thank you very, very much. It's been a pleasure. I will set you guys free. I will make the recording available, but probably what we'll end up doing, it should appear in the chat, but I know sometimes people find that difficult to download. So we'll probably be adding this to YouTube at some point, and I will share the link with you all at that point, and hopefully we'll be sharing it with lots of other people too, and we'll all become internet stars. Maybe as famous as that council. At least no one demanded control of my screen on this one. But apart from that, thank you very much, and I'll see you all later.